Let's talk about cancer since we've been talking about toxins.
Mhm.
Uh, if you were to have a patient who was given a terminal diagnosis, let's say a glioblastoma. I had a dear friend of mine who had a glioblastoma, and the only treatment he was given for it was Avastin. And Avastin is a drug that makes the claim that instead of the glioblastoma killing you in 12 months, it may last 13 or 14. And that's what happened. Um, if you have a patient with a cancer to which there's no known cure, no effective treatment, what do you say to them? And is there any, Hail Mary kind of supplement or food that you would recommend that just might give a person some hope?
Okay. We don't have time for me to go into the answer that in detail, but I'm going to give you a broad overview, okay?
Okay.
Because the answer is that the garden variety cancers, like breast and prostate cancer, are generally the estrogen positive, are generally slow growing cancers. And those do respond to nutritional excellence. And I do give people, bok choy juice and beet juice, carrot, mixed together. I do give them greens in there. I do give them some extra turmeric and curcumin and mushroom extracts and EGCG. I do give them a special diet designed for that cancer. Yes, but each cancer has some different features that might make the recommendations a little bit differently. Like, for example, some tumors are more methionine sensitive and some is more
Right.
glucose sensitive. So the more methionine sensitive cancers, I may be particularly careful to be low in protein. And those cancers, I don't have them eating soy foods and hemp seeds. And when I'm low protein, just, keep methionine even lower. And there are some cancers like you might, like glioblastomas that are sensitive to sugar. That in those cancers, brain tumors are sensitive where I put them on a keto plant-based diet where I don't restrict methionine and protein, but I restrict fruit and keep them almost all eating all green vegetables and nuts and try to get them, moderate and carbohydrate restrict for that kind of. So the answer is there might be little different tweaks based on little different cancers. You know what I mean?
Hmm.
But we are able to achieve better outcomes than people just relying on conventional drugs. And there's a lot of studies that document this. There's studies, for example, that women with breast cancer followed for 10 years, a little flaxseed, lignans from flaxseed, reduced risk of death from reduced risk of cancer death, breast cancer death, related deaths by 71%. We're talking here about the same dietary portfolio that prevents cancer has been shown to extend lifespan and prevent recurrence in people who have cancer. And in my lectures and presentations, and I even published a study on this in the International Journal of Disease Prevention and Reversal, listing all these people who don't have cancer, who had advanced cancers. For example, one woman had metastatic ovarian cancer with 4 liters of metastatic fluid taken out of her collapsed lung, given 6 months to live. This is now 27 years later. She's still alive with no cancer. Another woman with metastatic ovarian cancer. Well, because when you kill the cancer with the aggressive cancer with chemo, you don't kill all the cancer cells. Some escape chemo and they grow back and kill you. But the body's immune system, made very strong, can seek out, identify, and destroy the remaining individual cells where it couldn't deal with such a large tumor burden to begin with for an aggressive cancer like that. I have lots of patients with metastatic breast cancer who have never been alive 2 decades or 3 decades later either, who've done exceedingly well. And so I'm saying to you that with the slow growing cancers like garden variety breast cancer and prostate cancer, chemo isn't even worth it. It doesn't work well. You don't extend life enough for the risks you get. And the diet's effective but with a very aggressive cancer, like early stage aggressive premenopausal breast cancer or ovarian cancer, then chemo might be indicated. And then we still do the diet because even though chemo is indicated, chemo doesn't give people a long life. It could be the cancer comes back and kills them. And the cells that grow back now are chemo resistant. So it's in other words, I can't do that question justice because it's complicated based on different types of
Right.
cancer. But yes, the dietary and nutritional excellence that we incorporate along with the appropriate treatment, and sometimes the appropriate treatment is nothing, right? Is the key factor enabling a person's longevity, more so than what the oncologist can do with chemo.